linda familia na marafiki dhidi ya magonjwa.
The UHC coverage journey is on. NHIF is working under the guidance of the Ministry of Health in the UHC Step Up, which presents an opportunity to secure Kenyans access to quality health services without suffering financial hardship. So take the bold step today and safeguard your families by enrolling to NHIF to ensure health for all.
Now, with the passage and enactment of the NHIF bill, what will this mean for the universal health coverage itself as we're geared up to that particular upscale in Mombasa County? And none other than the right person to be speaking to this particular topic too is none other than the NHIF Chairman, that is Dr. Louis Nguyai. Karibu sana, Chairman.
Asante sana. Thank you very much.
Thank you so much.
It is Honorable Louis Nguyai.
Yes.
I could be a doctor if I got a PhD,
yeah,
but I have no relationship with medical fraternity as far as medicine, studying medicine is concerned.
Yes, but hopefully you'll get there, and of course we'll be.
Hopefully, I think I will lean more on the medical insurance side. So it will always be medicine and insurance.
Okay.
Yes.
And of course, let me start with this, Chairman. It's a broad question, but how has the journey been for you, especially when it comes to the universal health coverage itself in totality, before we even talk about the enactment of the NHIF bill?
I think I'm happy with the way both the Senate and Parliament moved with speed. You know, there were other bills on the table, and some of absolute importance, some political by nature and had a lot of interests. But when it came to the issue of delivering good health coverage to Kenyans, there was serious unison between both houses. And even the challenges that we thought would come because of interests seem to have waned. So if I look at the bill and the amendments that we wanted, it would be probably we are between 90 and 95%. So I'd give it a 90 to 95% score, which means of the intent in the bill to ensure that Kenyans get universal health care, we have a 90 to 95% score. We could probably increase that a little by looking at subsidiary regulations and seeing how they will be enacted. And the subsidiary regulations are very key towards now talking about universal health coverage. Now, universal health coverage, as you know, is that every single Kenyan should have access to health care where and when they need it without suffering any financial constraint or loss. That means if you think about a woman in West Pokot, or somebody in Samburu, or somebody in Tana River, or somebody in the remotest part of Mandera, they should be able, through the NHIF coverage, to access health care near enough and not suffer financial loss. So it's going to be a journey. The first thing is to make sure that everyone is covered. The legislation does provide the clause that everybody above 18 has to register as a membership. I think it's important that we say when you register as a membership, it's not a fact, a necessity that you have to pay. But let us first know who you are, where you are. Let's get the statistics. Let us know why you're not paying, if it is mandatory for not paying, if you are unemployed, if you have financial constraints, if you probably have some form of disability. Anybody above 18, I would urge immediately the regulations come out, because there will be important rules and regulations that will affect you in the future if you want to access government services. When you register and you biometrically put yourself there and you don't have the money, at least we know where you are. We can then go to the government and say, we have X unemployed number of people, we have Y indigents, we have this disabled, we have, you know, then we can start having a discussion of how do we get to that level. Yes.
And of course, given that we're talking even about the enactment of that legislation, which I do understand is very trivial for the insurer itself, given that you're also the drivers, you're the face of this UHC program itself, how has it added to your ammunition to deliver the realization of this goal itself?
Okay, you know, the enactment of the amendments is amongst a raft of necessary changes that were necessary to change NHIF to become the main driver of universal health coverage.
Yes.
Number one was legislation, and that's the enactment of the law.
Yes.
Number two, which was very important, was organizational transformation, which is now bringing in skills and capacity who have knowledge, who lean towards looking at how efficient are we operating, what are the risks involved, how do we make sure that it is affordable, how do we work on revenue, and all that is a total transformation that is taking place as we speak. There's a task force in Naivasha that's meant to bring back human resource instruments to show the suitability and capacity of existing staff and the potential we need in that. And in that whole organizational transformation, we then become a lean, mean organization. But for that to happen, we then have to have what you call technological transformation, which is IT.
Yes.
And because whatever is being replaced as a man, for it to be efficient, it has to be very efficient. And one of the good things that came out with the legislation is because this organization, like other medical insurance organizations, has a huge element of fraud. And fraud can be from overuse to misuse to misrepresentation to impersonation. That whole element, we are trying to resolve it, one, from a systems-based, by having a centralized health information management system that is centralized to any of our service providers, so we can see specifically what is going on. And with the journey started before I got into NHIF, I must commend the people who were before me, because they have been able to put in place biometric and e-claims. But within the time I came here, within 3 months, with the real support of the management, we were able to put 100% in claims, 100% biometrics, which basically means if you go to a hospital, you don't need to do anything. You just need to present yourself there.
Yeah.
If we've never taken your fingerprints, we'll take your 10 fingerprints. Sorry for what you are right now. We can only take your 8 fingerprints. And once you take your 8 fingerprints, you now get into our database and you can access healthcare services anywhere at any time, because it is now linked to all our 10,000 health service providers. So that was very important for us to make sure that now we push that organizational transformation to the next level. So I've talked about legislation, I've talked about organizational transformation, I've talked about IT. The fourth that was very important is to now create a benefits package that makes sure that there's harmonized standard benefits that Kenyans can get wherever. For example, I'll give you one of our biggest costs is cancer. The second biggest cost is dialysis. The third biggest cost is troubles from non-communicable diseases. And all those packages really eat into our system. In that benefits package, we then introduced now other elements that would now look into the actuarial pricing, into how we can spread that risk, into how we can have a stop loss reinsurance, and how we can relate even with the insurance industry, so that we do not now carry the whole burden, but share it across. And those are the things that I think will be very important towards the sustainability. But to the mwananchi, all we are telling them is all this technical jargon sahau. Take an NHIF card. For a family, it costs 500 shillings. You probably have 4 or 5 people in your family. It's 6,000 shillings in total. If you divide it, it's less than 2,000 shillings or 1,000 shillings per month. It's about 100 shillings or 80 to 100 shillings per month. And I can tell you, because I have had that experience. I have taken an NHIF card for my mother-in-law, for example, and when she got hospitalized and I only paid 6,000 shillings, her whole service in Nairobi Hospital, her whole bill was paid for the condition that she had. So it was 300,000 shillings. And so I think we have to keep universal health coverage simple to the Kenyan. and say, if you have this card, you will not suffer financially. And we have to say it in a way that they become ready and willing and wanting to take the card. And if they can afford, they can be ready and willing and wanting to take the card, knowing that if they take it because they can afford, they will not have taken advantage of their relative or other Kenyans who cannot afford. Yes.
And of course, given that I know you're running a tight ship, you have just expounded on the importance of even getting that particular card. One would wonder, what are some of the policies have you put in place to ensure there that system of check and balances?
Okay, besides the IT systems of check and balances, we have now also very major regulatory systems. We have upped the penalties, we have increased the level of quality assurance. We have now introduced the issue of case management, which all are technical, but basically case management is checking. If you go into hospital and you're meant to be there for 1 day for this condition, why were you put in for 5 days? So by the time the second day is coming, there's a red flag saying, hey, this person only needed 2 days. For example, an appendectomy, you don't need more than 2 days nowadays, or 3 days, or for childbirth for that matter. So then you can go and get into the case management to know how those ones can be put in place. So I think with the reform that we have done within the organization, expanded those particular departments, and very soon we are hopeful that we'll be able to get and attract from within and from without real capable personnel. I think we'll be able to get there. It's a trip, but it's a trip that we believe that can happen quickly and fast. We'll also change our way we reach out to our customers. We will move to agency models. It can be agency banking models. It can even be the agency. Why not even partner with Safaricom? But we also look at data that exists within our partners, whether it's KRA, whether it's NSSF, whether it's even the private ones like Safaricom and the Airtels, to see who amongst them is not covered and how can we get to them so that they can get the good news that it is cheap and affordable to get access to healthcare.
And my final question to you today,
Yes.
sir, will be, given that we are going for that particular UHC scale up in Mombasa County, what should people look out for when it comes to that particular launch itself?
I think the first thing is they should look at, particularly, which I hope you are covering, are the success stories of people who have had the benefit of utilizing NHIF, and particularly the testimonials themselves. That is the most important. The proof of the pudding is in the eating. They can be all the high and glamour, but I must say that one of the big things that this government has put in place and has been experienced across the country is the delivery of cost saving and free healthcare. If you look at people who have an NHIF card, when they go for outpatient treatment, because they are capitated, they don't pay anything. When they go for a CT scan, they don't pay anything. When they go for an MRI, they don't see anything. When they get renal dialysis, then they need to be taken care of, they don't pay anything. When they get cancer, we pay up to 2 million. When they, so I think those testimonials are the real things that people should look at when we go there, and understand that these are our fellow Kenyans. They've enjoyed the benefits of the service. They too can enjoy the benefits of the service. Yeah.
Thank you so much.
Thank you very much.
Thank you so much for your enlightenment.
Okay.
This is the NHIF Chairman, Louis Nguyai.
Yes.
Thank you so much, sir, for
Yes.
at least enlightening us on how even important that bill will be when it
Yes.
comes to the universal health coverage. Thank you so much, sir.
You're welcome.
And of course, the conversation does not end there. We'll be talking to so many people, especially in the Ministry of Health itself. You just heard from the NHIF side of it all, but we'll be going to the Ministry of Health to just get more deeper into this particular conversation. And of course, see you till then.
Thank you very much.
Linda familia na marafiki dhidi ya magonjwa.